And welcome back. March of Dimes works really hard to fight for the health of all moms and babies. Here in Kentucky, March of Dimes works to improve maternal and infant health through advocacy, education, and community collaboration. Joining us today to talk more about the 2025 March of Dimes report card is Director of Maternal and Infant Health Initiatives, NIKKI Boyd. Please welcome. So nice to meet you. So tell me about what is preterm birth and what are some of the factors involved?
Of course. So March of Dimes releases a yearly report card that grades states on their preterm birth. Okay. And so we define preterm birth as a baby born before 37 weeks. So typically a baby is full term about 39 or 40 weeks. So if you're born a little bit earlier, there's some problems that can arise with undeveloped lungs, trouble breastfeeding, and so it can lead to some complications.
Wow. So how did Kentucky get an F?
Right. So when you look at the rates of babies born preterm, we're sitting at about 11.6% of births are considered preterm, whereas the rest of the U.S. is a little bit lower. And so we see things like our obesity rates, hypertension, or high blood pressure rates here in Kentucky with moms. Sometimes preterm birth just happens. There's no reason, there's no rhyme or reason, but for those that we can prevent, that's what we're here to do.
So how do you prevent that, though?
Right. So one of the biggest things is prenatal care. Another report that we release is something called the Maternity Care Deserts Reports. So in Kentucky, women travel about an average of 30 miles to access care, right? And so when you compound that in with distance to care, and maybe you have other kids or transportation's a barrier, or it's hard to get off work, it's hard to get that prenatal care. And then when you think about, I have other what we call comorbidities, something like high blood pressure or diabetes, where you have to go a little more frequently, it makes it really challenging, right? And so some of those comorbidities can have an impact on early delivery.
No, I mean, it's so important because I'm a mom of multiples, so I totally relate. You know, when you first, you're like, whoa, wait a minute, I have 2 babies. I have to really, I mean, take this really seriously. I mean, so prenatal care, I'm just saying prenatal care is really, really important to take care of yourself. So, so what is the March of Dimes doing to help Kentucky improve upon the health of moms and babies?
Sure. So as an organization, so we're a national organization. We've been in existence for about 85 years, believe it or not.
Wow, 85.
We were created by President Roosevelt to eradicate polio. And so when that was eradicated, like, well, what do we do next? And so we worked on birth defects and ultimately preterm birth. And so what we're doing nationally is, we're doing research. There's some amazing research. There's a podcast called Modcast that you can follow some of that research on. Modcast.
Okay.
Yes. But then here locally, what we're doing is really working with our health departments, our perinatal quality collaboratives, to address some of those issues around like hypertension, diabetes. I'm not sure if you've ever heard of the word doula, but a doula is a non-clinical person that helps support births.
Yes, I have heard of that.
And so we found them to be very impactful in helping to support and have better outcomes for moms.
You know what? That is so important to have somebody along the way, because somebody actually did that, was like, hey, make sure you do this, make sure you do that. And that was really, really critical, even with me, in terms of having multiples.
Well, you don't know what you don't know, right?
No, you don't know what you don't know. And trust me, I didn't know anything about having twins. So you got that right. So what can people do to get more involved in March of Dimes? We have about 15 seconds left. What can people do?
So obviously there's advocacy work you can do. You can directly donate or get more involved in like the work, what we call the mission that we do. So really dive in and advocate for yourself about how can I be better about diabetes and hypertension, and then join us at some of our signature events called March for Change, March for Babies, and Signature Chefs Auction that we host here in Lexington.
Okay, wonderful. Well, sign me up. No.
Love to have you.
All right, so nice to meet you, NIKKI. Thank you for coming to the show.
Thank you for having me.
We'll see you next time. Don't go anywhere. More High Noon after the break.